Hi, this is Hariom for our C winner. Today we are at Trichy, so I'm going to talk about a story which I learned when I was an undergraduate student here. So I was in first semester and didn't have anything to do in the clinic, but we were posted at the clinic, and we had this one patient with head injury, and he also had some issues with orientation and things like that. Now, this patient was rehabilitated when I was in the first semester, as I said, and they will do all sorts of exercises to him. He will undergo probably a strengthening exercise, can't remember properly, and some amount of passive movements also, I'm assuming, and also some deep training also. One of the important things also they gave him at that particular point of time was cycling. They gave him static cycling exercise. Now this patient, as I told you, had some amount of problems with his orientation, so every 2 or 3 minutes somebody has to keep on shouting at them or sort of cajole them into doing things. Somebody needs to be constantly motivating. So they will put him on a static cycle and they will sit on the cycle and sort of start doing it. After probably half a minute or 1 minute, depending upon what his levels at that particular time, he will stop. He will just stop and just be like this. And the interns and the other people who are around him will start calling his name and telling him do this, that, and then afterwards again he will start cycling. This kept on going from I don't know how long it was, because when I joined college he was already there for probably 3 months, I suppose. So after 1 or 2 months, once I was watching him from afar because I was not part of the treatment team, and he started cycling and then he stopped. And again people started saying his name and calling him and telling him start cycling. And he put his hand up like this and said, I know cycling is good, but this cycle is not going anywhere. Why am I driving this? And it had such an impact on me. I could remember this. This happened in 1990. I could still remember it. 91, I think. So I can still remember it, and it had a great impact on me. One of the things when I wrote my book on stroke rehabilitation, I took this to heart, and we wrote it as a principle that all activities or any exercise you give to your patient, that it should be meaningful for your patient. If the patient thinks that I'm trying a static cycle for no particular reason, it's not going anywhere, then the patient's motivation level is going to be very, very less. His compliance with the exercise is going to be very poor. Also things comes into play. So today's story is be meaningful when you're preparing your exercise, and not meaningful for you but for your